Hello everyone and welcome to my channel Body Mind Healing. My name is Maria Sanchez. I am a holistic health consultant, a family nurse practitioner, a psychiatric mental health nurse practitioner, and a doctor in nursing practice. The case for today is bipolar disorder from a medical view. Bipolar disorder is a chronic mental health condition marked by dramatic shifts in mood, energy, and activity levels. These mood episodes range from emotional highs called mania or hypomania to lows called depression, and they can significantly interfere with daily life, relationships, and work. Episodes may last from days to weeks or even months and often cycle unpredictably. The most common types of bipolar disorder are bipolar disorder type 1 and bipolar disorder type 2. Bipolar disorder type 1 involves at least one manic episode lasting a minimum of 7 days or requiring hospitalization. Depressive episodes in this type are common but not required to meet the diagnosis. The manic episode symptoms include elevated or irritable mood, inflated self-esteem or grandiosity, decreased need for sleep, rapid or excessive speech, racing thoughts and distractibility, heightened goal-directed activity or agitation, risky behaviors, including reckless spending, sexual indiscretions, etc., and in severe cases, psychosis, meaning delusions or hallucinations may occur. The depressive symptoms include persistent sadness or hopelessness, fatigue and sleep disturbances, feeling of guilt or worthlessness, trouble concentrating, and suicidal ideation. The bipolar type 2 disorder is characterized by at least one major depressive episode and one hypomanic episode, but there are no full manic episodes with this type. The hypomanic episodes are similar symptoms to mania but less intense, and that's what makes the difference between type 1 and type 2. They last at least 4 days. There is no psychosis or need for hospitalization. In most cases, there are always exceptions, but still causes noticeable changes in mood, energy, or activity. The depression in bipolar type 2 is often more frequent and severe than in type 1, and there is a higher risk of suicidal thoughts or actions. It is important to note that in bipolar disorder, there is a mood called cyclothymia that involves chronic fluctuating low-level symptoms of hypomania and depression for at least 2 years without meeting the full criteria for either bipolar I or bipolar II, but we will address this disorder in another video. Looking together at the key differences between bipolar type 1 and bipolar II, we have that the high mood type in bipolar I is mania and is severe, and in bipolar II is hypomania or milder. The depressive episodes in bipolar I are common but not required, and in bipolar II are required to meet the diagnosis. Hospitalization and psychosis in bipolar I often occurs, and in bipolar II are rare. The diagnostic clarity for bipolar I is more evident due to the severity of the symptoms, and in bipolar II is often misdiagnosed as depression. Bipolar disorder can severely impact daily life. It can disrupt work, education, and personal relationships, might lead to social isolation and stigmatization, has an increased risk of substance use and suicide, can co-occur with anxiety, ADHD, or personality disorders, requires ongoing lifestyle adjustments and support. The treatment approaches for bipolar disorder include medication, psychotherapy, and lifestyle modification. Under medications, we have mood stabilizers such as lithium, Depakote, Tegretol, lamotrigine, etc. Antipsychotics such as quetiapine, olanzapine, Latuda, Abilify, Risperidol, Vraylar, etc. Antidepressants, this class is used carefully because it can induce mania. It is usually combined with a mood stabilizer. Anti-anxiety medications can be used for short-term relief of symptoms. and several other medications can be used depending on the presenting symptoms. Psychotherapy helps patients recognize triggers and manage mood patterns. Some of the most common psychotherapies include cognitive behavioral therapy, interpersonal and social rhythm therapy, family-focused therapy, and dialectical behavioral therapy. Under lifestyle management, it is important for patients to maintain a regular sleep schedule, exercise and eat well, avoid drugs and alcohol, manage stress effectively, build and maintain support networks with family, friends, and peer groups. Important considerations to keep in mind are that bipolar II is not less serious than bipolar I because depressive episodes can be more debilitating at times. Misdiagnosis is common, particularly for bipolar II, which is often mistaken as unipolar depression or what we know as depression. There is currently no cure for bipolar disorder, but with consistent treatment and patient compliance, patients can lead fulfilling lives. In summary, bipolar disorder is a complex mental illness that comes in several forms, most commonly bipolar I and bipolar II. These two differ in the severity and nature of mood elevation. Effective management involves a combination of medication, therapy or psychotherapy, lifestyle modification, and support systems, but most important of all, patient compliance. Early diagnosis and long-term treatment are key to minimizing the impact of the disorder. May the inner peace that we cultivate today expand and guide us always. Until next time.